Sexologists from Samadhan Health Studio bring to you a refreshing podcast, My Doctor Tells. Here you will find solution to all common sex problems directly from the experts. Know about vaginismus, unconsummated sex, erectile dysfunction, premature ejaculation, masturbation addiction, nightfall, and truths about several sexual myths. I am Dr. Ashok Koparday in association with Dr. Hetal Gosalia, and we have made all of this and much more available to you all for free. No strings attached, no sign-ups, no email IDs required at mydoctortells.com. Why has Rajesh come to our office? He's 30, he's married for 6 months. He's extremely tense. We are attentive, we are listening to him, and he tells us that he has got a problem of ED and PE, erectile dysfunction and premature ejaculation. And we listened to him. He said he has been to Maldives for honeymoon. It was beautiful. What was beautiful was the sky was beautiful and the landscape was beautiful, but the sexual life was zero. In the sense that he was not able to have a sexual intercourse with his wife. He tells us that there is some problem in him, there is a weakness, and this weakness, because of this weakness, he is not able to do sex. He is not able to penetrate, he is not able to, I'm not able to do sex with my wife. And then we asked him, so what does she have to say? He said, no, she's very good, she's very understanding. And then we had a talk about this, and then she suggested to go meet a sexologist or a doctor who will treat you for this. And this guy comes to us. Do we treat him for erectile dysfunction? And how do we treat him? Do we treat him for premature ejaculation? And how do we treat him? Here, please listen attentively. This is a very tricky question which I have asked. It appears very simple for him, for Rajesh, that he has ED because he has done a lot of Google search and he has PE. We ask him that, have you tried to insert one finger in the woman's vagina? He says no, she wouldn't even allow me to touch there. We unravel through a systematic method of questioning in which this is history taking. Most of our diagnosis comes not from technical gadgets but from a thorough, proper history taking. So we understand that when he would attempt, what was your experience when you first attempted sexual intercourse? So he said that she was a little scared and she pushed me and she said, please wait. But then, I don't have that power. My erection doesn't last long and I come soon. So there is no point, I just can't. And now his frequency, they're almost not having even attempt at sexual intercourse. Their sexual intimacy is waned away. She has become a workaholic, he's become a workaholic. And they have sort of closed the chapter of sexual activity in the bedroom. This is serious. They are not even had completed their first anniversary. This case of Rajesh is what is technically called as unconsummated marriage or unconsummated sex. That is, between two willing partners, consenting partners, sexual intercourse has not happened. This can happen now. There are some couples who are coming to us, or some men who are coming to us before marriage, and they say that I have got ED and I have not been able to satisfy my partner because I couldn't do it. This case is called as unconsummated marriage or unconsummated sex, where the person is not able to insert his penis in the vagina. I am not using the word penetrate, which is commonly used, sexual penetration, because it is penetrate sounds like something you take a hammer and a nail and you hit something and something penetrates the wall. No. Actually, the penis just glides inside the vagina. So this is how the sexual intercourse in its natural flow happens. So here he is advised, his diagnosis has shifted. Have you noticed that? His self-blame has gone away, and the couple therapy is what is recommended in this case, in which we talk to the wife also or to the female partner, if possible, whenever possible. There are some instances where there is hesitation and they say, whatever you want to say, you talk to us, tell us, treatment therapy, talk to us, talk to me. She won't come, she's so shy, that's also okay with us. We are now got the expertise of communicating to the wife or the female partner, the girlfriend, to the boy. What we want him to understand is that here comes why I am saying this is UC or unconsummated sex. What happens is in the vaginal orifice is not open like this. The vaginal orifice is a potential space. The vaginal orifice is a potential space, and when the penis is about to get inserted, the external orifice contracts. The pubococcygis muscles contract, and here the penis is not able to go in. And when he's just doing this movement, thrusting movements, his excitation levels are so high that he comes. There's a discharge, and after that he cannot immediately get an erection. This is normal. Not getting an erection soon after first ejaculation is called as refractory phase. This is physiological, this is normal. But he labels himself as erectile dysfunction, as premature ejaculation, not knowing that the entrance is closed and he is not able to penetrate inside. So this case is of unconsummated sex, which needs a different line of treatment, wherein without, again, please note, without using any medicines, without using any dilators, without using any anesthetic gel, without using most of the things that are given in the Google, on your Google search or wherever you find information for treatment, without using any of this, smoothly, naturally, sexual intercourse can be possible in this couple. So, usual story, more than half of the population, more than half of the people who have come to us in this last 2 to 3 decades, they have come after marriage. But recently, there is a small and definite proportion of couples or young boys who are coming to us just before marriage because they have labeled themselves as PE or ED when actually the condition is unconsummated sex. How is the treatment? The treatment is easy, it is smooth. What do? Do we do a per vaginal examination the way a gynecologist does? No, we don't do that. So we in fact strongly recommend that you do not go to a gynecologist, you do not go to a urologist, you do not go to a psychiatrist. What you need is a competent sex therapist who will deal with this situation, as I told you, without any medication. Here, please understand, I want you to be as free of self-blame as possible, because understand that you are not educated in sex, in the sense that even if, suppose you don't know driving at all, and if you were to be given the best of Mercedes Benz and you were told to go on a ride with your girlfriend, what would happen if you just attempted to drive a car? You would dash, you would have accidents, you will not be able to drive. You have to have a driving license, you have to learn driving. So in a similar way, there are certain things you have to learn please know that you have not been, your learning has come from, let us be frank, honest, your learning has come from pornography, whatever you have been watching. So that gives you a lot of misinformation, lot of unrealistic expectations from yourself about sexual activity, and that is why you have landed with a problem. So unconsummated sex can be very easily treated with the proper, correct guidance. So don't delay going to a competent sexologist when you have this problem. There's a lot of love, there's a lot of joy, there's a lot to explore when two birds are together, when two lovebirds, when a charming guy and a beautiful girl, when you are together, when you are in love, you are educated, you are intelligent. So my only suggestion, and a strong suggestion, is that please go to a competent doctor, get it resolved. You would be surprised to know, and this is coming from facts from our case papers, which I am confiding in you. People come to us not 1 year, not 2 years, but 5 years after marriage without sexual intercourse. And they only come when there's a lot of pressure as to when is the news. So when the elders, when asked for, they are expecting a baby. So for 2 years, the elders out of respect do not broach this topic. So this is the time they come. So come before your first anniversary, come as soon as possible when you have found that you are not able to insert, and that is when you are not able to do sexual intercourse. It's not a crime. This unconsummated sex can be dealt very beautifully. Usually the guy takes the onus of responsibility and the burden and self-blame, and he goes into depression. Often is not able to put his best in his work life also. So if you see a sad face in a guy who's newly married, so you can suspect that things are not going on well, in spite of the fact that they love each other so much. What is not going well? Something is not going well in the bedroom. So sexual intercourse is not happening. Here we are to help you. We'll tell you the other aspect, why the guy need not be blamed and need not be treated for his ED and PE, for which Rajesh has walked into my office. But then what should be the treatment? That we will tell in the next topic. So we'll be with you back again very soon.